Hello everyone, this is Dr. Divya and topic for today's discussion is teratogenesis. Teratogenesis is a prenatal toxicity characterized by structural or functional defects in the development embryo or fetus. It also includes intrauterine growth retardation, death of the embryo or fetus, and transplacental carcinogenesis, in which chemical exposure of the mother initiates cancer development in the embryo or fetus, resulting in cancer in the progeny after birth. Factors which is influencing prenatal risk: the timing of the exposure, the amount of exposure, the number of teratogens, genetic, and being male or female plays an important role in influencing prenatal risks. And this is about critical periods of prenatal development. Moving on to the teratology, the study of factors that contribute to birth defect is called teratology. Teratogens are environmental factors that can contribute to birth defects and include some maternal diseases, pollutant, drug, and alcohol. And these are all the agent to cause disruption in human fetal development. How alcohol is act as a teratogen. In terms of frequency and cost to society, the most devastating teratogen is undoubtedly ethanol. In the year 1968, Lemoyne and colleague noticed a syndrome of birth defects in the children of alcoholic mothers. This fetal alcohol syndrome, that is FAS, was also noted by Jones and Smith in the year 1973. Babies with FAS were characterized as having small head size and indistinct philtrum, the pair of ridges that runs between the nose and mouth above the center of the upper lip, a narrow upper lip, and a low nose bridge. The brain of such a child may be dramatically smaller than normal and often shows defects in neuronal and glial migration. And this diagram shows the comparison of a brain from an infant with fetal alcohol syndrome, shows in left, with a brain from a normal infant of the same age in right side. The brain from the infant with FAs is significantly smaller, and the pattern of convolution is obscured by glial cells that having migrated over the top of the brain. By taking prescription or over-the-counter drugs, about 70% of pregnant women take at least one prescription drug. A woman should not be taking any prescription drug during pregnancy unless it was prescribed by a healthcare provider who knows she is pregnant. Some prescription drug can cause birth defects, problem in overall health and development of the fetus. Illicit drugs. Common illicit drugs includes cocaine, ecstasy, and other club drugs, heroin, marijuana, and prescription drugs that are abused. It is difficult to completely determine the effect of a particular illicit drugs on a developing child because most mothers who use more than one substance and have other unhealthy behaviors. Pollutant. There are more than 83,000 chemicals used. Information on the effect of them during pregnancy. An environmental pollutant of significant concern is lead poisoning, which is connected with low birth weight and slow neurological development. The chemicals in certain pesticides are also potentially damaging and may lead to birth defects, learning problem, low birth weight, miscarriage, and premature birth. Pathogens as teratogenic agent. Another class of teratogen includes virus and other pathogens. Greek in the year 1941 first documented the fact that women has rubella, it's a German measles, during the first third of their pregnancy had a 1 in 6 chance of giving birth to an infant with eye cataracts, heart malformation, or deafness. This was the first evidence that the mother could not fully protect the fetus from the outside environment. The earlier the rubella infection occurred during the pregnancy, the greater the risk that the embryo would be malformed. Ionizing radiation. Ionizing radiation can break chromosomes and alter DNA structure. For this reason, pregnant women are told to avoid unnecessary X-rays, even though there is no evidence for congenital anomalies resulting from diagnostic radiation. Heat from high fever is also a possible teratogen. And these are all some medication which cause teratogens. And the environmental regulation of development. The environment can affect development in several ways. Development is sometimes skewed to normal circumstances that the organisms can expect to find in its environment. The larvae of many species will not begin metamorphosis until they find a suitable substrate. In other instances, symbiotic relationship between two or more species are necessary for the complete development of one or more of the species. And these are all the references. Thank you.